CEN test prep exam in USA. Question 1. Which finding is consistent with an anterior shoulder dislocation? Option A. Arm held in internal rotation and adduction. Option B. Arm held in external rotation and slight abduction. Option C. Patient unable to flex the elbow. Option D. Numbness of the medial forearm. The correct answer is option B. Arm held in external rotation and slight abduction. Question 2. Meningitis is an inflammation of the. Option A. A brain parenchyma. Option B. Meninges covering the brain and spinal cord. Option C. Peripheral nerves. Option D. A ventricles of the brain. The correct answer is option B. Meninges covering the brain and spinal cord. Question 3. A patient in the emergency department suddenly develops pulseless ventricular tachycardia. The monitor shows a wide minus complex tachycardia at 220 bpm. What is the priority intervention? Option A. Administer amiodarone 300 mg for push. Option B. A synchronized cardioversion at 100 J. Option C. Immediate high minus quality CPR and defibrillation. Option D. A transcutaneous pacing. The correct answer is option C. Immediate high minus quality CPR and defibrillation. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Testicular torsion is a surgical emergency that requires intervention within. Option A. 24 hours. Option B. 4-6 hours. Option C. 2-3 days. Option D. It is not a surgical emergency. The correct answer is option B. 4-6 hours. Question 5. A patient with anaphylaxis develops acute respiratory distress, wheezing, and hypotension. What is the priority medication to administer? Option A. Albuterol nebulizer. Option B. Intravenous diphenhydramine. Option C. Intravenous corticosteroids. Option D. Intramuscular epinephrine. The correct answer is option D. Intramuscular epinephrine. Question 6. A patient with a history of alcohol abuse presents confused and ataxic. To rule out Wernicke's encephalopathy, the nurse should prepare to administer. Option A. Folic acid. Option B. A vitamin B12. Option C. Thiamine. Option D. Magnesium sulfate. The correct answer is option C. Thiamine. Question 7. The priority patient for a trauma team activation based on mechanism of injury is. Option A. An adult who fell from standing height. Option B. A pedestrian struck by a car traveling 15 miles per hour. Option C. An adult ejected from a vehicle. Option D. An adult with a gunshot wound to the forearm. The correct answer is option C. An adult ejected from a vehicle. Question 8. A Call's fracture involves the. Option A. Proximal humerus. Option B. Distal radius. Option C. Femoral neck. Option D. Tibial plateau. The correct answer is option B. Distal radius. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. The classic triad of symptoms for a ruptured abdominal aortic aneurysm, AAA, includes. Option A. Hypertension, bradycardia, headache. Option B. Abdominal pain, hypotension, and a pulsatile mass. Option C. Fever, chills, flank pain. Option D. Dysuria, frequency, urgency. The correct answer is option B. Abdominal pain, hypotension, and a pulsatile mass. Question 10. A patient bitten by a rattlesnake develops severe pain, swelling, and ecchymosis at the site. The priority intervention is. Option A. Application of ice to the bite. Option B. Incising and suctioning the wound. Option C. Application of a tourniquet proximal to the bite. Option D. Administration of antivenom, crotality. The correct answer is option D. Administration of antivenom, crotality. Question 11. Which ECG finding is most indicative of hyperkalemia? Option A, prolonged QT interval. Option B, peak T waves. Option C, ST depression. Option D, delta waves. The correct answer is option B, peak T waves. Question 12. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A, a neurological status. Option B, a renal function and urine output. Option C, skin integrity. Option D, cardiac rhythm and rate. The correct answer is option B, renal function and urine output. Question 13. The hallmark sign of compartment syndrome is: option A, pain relieved by elevation. Option B, pain out of proportion to the injury. Option C, absent pulse in the affected extremity. Option D, pitting edema. The correct answer is option B, pain out of proportion to the injury. Question 14. A patient experiencing a tonic-clonic seizure is in the emergency department. What is the priority intervention? Option A, restrain the patient firmly. Option B, insert a bite block. Option C, maintain airway and administer benzodiazepines as ordered. Option D, obtain a stat CT scan. The correct answer is option C, maintain airway and administer benzodiazepines as ordered. Question 15. Which laboratory value is most indicative of acute kidney injury? Option A, elevated white blood cell count. Option B, elevated creatinine and BUN. Option C, decreased platelet count. Option D, elevated liver enzymes. The correct answer is option B, elevated creatinine and BUN. Question 16. In the Emergency Severity Index (ESI) 5- level triage system, a patient who is confused, lethargic, and has a respiratory rate of 8 would be classified as: option A, TSI level 1. Option B, TSI level 2. Option C, TSI level 3. Option D, TSI level 4. The correct answer is option A, ESI level 1. Question 17. The most common cause of lower gastrointestinal bleeding in adults is: option A, gastric ulcer. Option B, diverticulosis. Option C, esophageal varices. Option D, Mallory-Weiss-Tier. The correct answer is option B, diverticulosis. Question 18. Necrotizing fasciitis requires what priority treatment? Option A, broad-spectrum antibiotics alone. Option B, immediate surgical debridement. Option C, hyperbaric oxygen therapy. Option D, wound vac placement. The correct answer is option B, immediate surgical debridement. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. Which of the following is an early, compensatory sign of shock? Option A, anuria. Option B, metabolic acidosis. Option C, tachycardia. Option D, unconsciousness. The correct answer is option C, tachycardia. Question 20. A patient presents with substernal chest pain radiating to the left arm, diaphoresis, and nausea. The ECG shows ST- segment elevation in leads 2, 3, and AVF. Which coronary artery is most likely occluded? Option A, left anterior descending artery. Option B, left circumflex artery. Option C, right coronary artery. Option D, left main coronary artery. The correct answer is option C, right coronary artery. Question 21. After a blow to the nose, a patient develops clear, watery drainage that tests positive for glucose. This indicates: option A, allergic rhinitis. Option B, nasal mucosal secretions. Option C, CSF leak, rhinorrhea. Option D, sinus infection. The correct answer is option C, CSF leak, rhinorrhea. Question 22. Which type of shock is characterized by decreased cardiac output, elevated systemic vascular resistance, SVR, and jugular venous distension? Option A, hypovolemic shock. Option B, distributive shock. Option C, cardiogenic shock. Option D, neurogenic shock. The correct answer is option C, cardiogenic shock. Question 23. The antidote for acetaminophen overdose is option A, naloxone, option B, N-acetylcysteine, option C, flumazenol, option D, sodium bicarbonate. The correct answer is option B, N-acetylcysteine. Question 24. A patient with a Le Fort 3 fracture is at highest risk for option A, dental malocclusion, option B, airway compromise, option C, corneal abrasion, option D, temporomandibular joint dysfunction. The correct answer is option B, airway compromise. Question 25. A patient with a history of atrial fibrillation who is not on anticoagulation presents with acute onset right leg pain, pallor, and absent pulses. The nurse suspects option A, deep vein thrombosis, option B, acute arterial occlusion, option C, cellulitis, option D, compartment syndrome. The correct answer is option B, acute arterial occlusion.